Bioethics, by definition, is a field that studies the ethical issues that occur in the biological and medical context. Every day, medical cases face challenges in ethical perspectives. For this reason, bioethics is grounded on four basic principles that serve as a guide for medical practices. These principles are autonomy, justice, beneficence, and non-maleficence. Autonomy refers to the patient's right to make certain decisions and have certain thoughts regarding their medical care. Beneficence demands that the healthcare provider tries to give the best possible care to each and every patient. Non-maleficence insists in doing no harm to the patients, their family, relatives, and society as a whole when treating the patient. Justice is the idea that every human being has the equal right to receive the same care and treatment. Bioethics essentially explores the issues that come with these principles when they are improperly respected or when the principles clash with each other. An example to a bioethical issue case can be viewed in this question. What should a doctor and a chaplain do when a patient believes God wants him or her to suffer? This example is seen in hypothetical number 8, which introduces us to Mr. L, a 47-year-old father of two with a history of alcohol abuse, but has been sober for a year. He is admitted in the emergency department and is diagnosed with pancreatitis and biliary colic and urgently needs a cholecystectomy procedure. Mr. L indicates before his surgery that he didn't want to take his post-surgery pain medication because God wants him to be in pain. His surgery is delayed and Dr. J meets him to discuss his request and quickly come to an agreement since the medical team didn't want the surgery to be delayed for more than 24 hours. After listening to Mr. L, Dr. J explains the medication reduces pain and breathing, helping him take full breaths and reducing his risk of getting pneumonia. She then asked Mr. L if he would talk to a chaplain, and he agreed. Dr. J explains to Mr. K, the chaplain on call, that in good conscience they cannot not give him the pain medication since it would be bad care. She respects his beliefs but won't be forced to give bad care just because of his beliefs. When Mr. K, the chaplain, speaks to Mr. L explains God wants him to be in pain for his past wrongdoings, and his suffering will atone for some of his sins. The problem here is very clear. The patient, Mr. L, doesn't want to take the post-surgery pain medication for personal and religious reasons. Yet, doctors have the duty to provide the best possible care for his or her patient. In this case, Dr. J wants to stay true to her role as a doctor by providing Mr. L proper post-surgery care, by giving him pain medication that will not only help with the pain, but also prevent other problems that could arise from the surgery. If we recall the four ethical principles, we can see how autonomy and beneficence with non-maleficence clash, as the patient has the autonomy or right to decide what treatments he desires, and the doctor's beneficent and non-maleficent intention to do no harm or at least minimize harm by pursuing the greater good. Like in any other bioethical situation, there are certain stakeholders. Stakeholders are those that are somehow related to the situation and will be affected by the decisions taken regarding it, and their input can directly impact the outcome. In this case, the stakeholders include the patient, Mr. L, who won't receive proper care without the pain medication, the doctor and hospital, whose duty is to provide the best care and can't do so without the patient taking the pain medication, the chaplain, who is the intermediary of the situation and understands the patient's religious reasons, but advocates for his post-operative well-being, the patient's family, which care for him and his good health, members of the patient's religious community, who might support the patient's point of view and help decisions. As we see, this scenario shows the patient's desire to decline post-operative pain medication against the doctor's judgment that not treating post-operative pain constitutes bad medical care. For Dr. J, the proper course of action must conform to good care, which for her requires providing effective pain medication after his major surgery. For patient Mr. L, the proper course of action requires refusing the pain medication under the religious belief that the pain he will suffer might atone for the past sins. In order to uncover possible solutions for this case, the purpose of medicine should be acknowledged, and the analyzing of the circumstances of accommodating religious beliefs in a medical context, as well as understanding the role of a chaplain. The traditional approach of medicine constitutes in preserving and restoring the health of a patient, where the health care provider seeks to relieve the patient's suffering by correspondingly attending his or her health. This traditional approach of medicine permits accommodating a spiritual understanding of suffering, such as in this case, as far as this doesn't oppose to the doctor's commitment to the patient's health. Physician-patient accommodation is a method where both the physician and the patient act with integrity to come to an agreement. Following the traditional approach to medicine, one shouldn't ask, how should Dr. J harmonize Mr. L's religious beliefs with her professional beliefs? Instead, the question is, does accommodating Mr. L's desires to decline pain medication undermines Dr. J's commitment to the patient's health? If evidence suggests that declining pain medication will increasingly reduce the chances of a successful operation, compromising Mr. L's recovery, or even threatening his health, then Dr. J should refuse to perform the procedure, regardless of the patient's personal motives of the request. On the other hand, if Dr. J concludes not taking the pain medication wouldn't have a negative impact on Mr. L's health, then she should provide her service even if she disagrees with his beliefs. Note that the reason for the refusal of medication does not really matter, although it is common for physicians to accommodate to religiously informed requests as respect of religious judgment. Dr. Day should explain her reasoning to the patient frankly and clarify that her logic is based merely upon her professional judgment. Also, if she listens to his reasoning to better understand it, Mr. L might open up to the possibility of coming to an agreement with her and do what she finds medically necessary. As a doctor, she should respectfully challenge his beliefs about suffering without depreciating his opinion. In this scenario, Chaplain K should also consider challenging Mr. L's religious beliefs, encouraging him to consider if his religious practice has other forms of suffering, but never intend to change his opinion about pain medication. While physicians are committed to the patient's health, chaplains are committed to the patient's spiritual care and the treatment process. Chaplain K's presence, prayer, and conversation with Mr. L could result in Mr. L becoming more inclined in refusing the medication. Such conflicts are sometimes inevitable, and respect for the patient's authority means allowing them to refuse medical care that we believe they desperately need. When patients disagree to a doctor's recommendation due to religious reasons, the doctors must try to understand their patient's reasoning, and with respect, try to reach a common ground which doesn't undermine the patient's authority nor contradicts their professional commitment to the patient's health. It is extremely important for physicians to be humble, patient, and respectful when dealing with such situations that interrupt their duty. By this, meaning recognizing the limits of their knowledge, skills, and power, and including chaplains when encountering scenarios relating to spiritual and religious concerns. It is evident that the work of a doctor can be more difficult and time-consuming than one might believe. Yet, caring for patients is the primary goal for a medical professional, and respecting the patient's autonomy and beliefs comes with it.